Okay, it is 12 o'clock and we're going to get started. I'm Joan Anderson with the Medical Society. Lots of information, lots of questions, and I just need to say at the onset, every presenter is going to give you what they know at this moment in time, but information is coming in literally daily. So we're going to be probably having more calls in the next couple of weeks than we've had in the past. So we're going to have first, thank you so much to Emily Manschreck, who is the director of the pharmacy at CHI St. E's. She's going to address just the overall viewpoint from a pharmacist standpoint. Then we'll follow up with Director Pat Lopez. She'll give an overview of the vaccine distribution and plan for Lancaster County, followed with both representatives from the hospital talking about their specific rollout that will impact not only their employees, but the physicians and providers in the community. This will be recorded, as well as when I send out the recording, I'm going to send out a YouTube recording that Dr. Spry sent to me just this morning. If any of you know Dr. Spry, I was shocked when he said he learned something from this YouTube from a vaccine guru, national vaccine guru. I think it'll be very informative, but just know that was one that we'll be sharing from Dr. Spry's input. So thank you very much, Dr. Spry. Emily, we'll let you get started. Again, thank you so much for joining us, and we'll let you take the screen.
Excellent. Thank you so much for that introduction. I'm Emily Manschreck. I'm a pharmacist. I'm the director of pharmacy at CHI Health St. Elizabeth in Nebraska Heart. And today I'm going to share what I know about the COVID-19 vaccine from a pharmacist perspective. And here we go. So a couple of things. One, that I have a couple things to disclose. As stated before, these vaccines are not approved by the FDA. So what I am sharing today is subject to change. The emergency use authorizations have not come out, and those will dictate some other guidance that might not be accurately reflected in what I'm presenting today. So this is really just accurate as of December 4th. You certainly have my permission to use these slides. And so what I'm going to review today are a handful of things, just the types of vaccines, front runners, approval timeline, some nuances about shipping and storage. There's a lot of questions about that. Just a second about the Nebraska vaccine plan that Director Lopez will share in greater detail. And then vaccine preparation and expiration, and maybe some frequently asked questions as well. I have here an illustration from my daughter, Claire. She's a third grader at Human Elementary, and this is us fighting the COVID virus. So there's 4 types of vaccines and 3 front runners. So we have Pfizer, Moderna, AstraZeneca. I'm going to spend most of my time talking about these 3, especially the Pfizer product. There are a number of vaccines, 58 currently in clinical trials, several in preclinical trials. There's a really fun tracker that you can find that's provided by the New York Times if you're interested in reading about these companies, or also the companies that are helping manufacture and distribute on behalf of these developers. So the first type of vaccine is mRNA. Messenger RNA is going to be the first genetic vaccines approved. So although these are the first, they're definitely not new. They've been studied for other types of vaccine development. They're pretty cool. They deliver a little piece of RNA from the coronavirus into the human body, and then when that enters our own human cells, they will create a spike that is basically mirrors the spike, that's the protein spike that's seen on the actual coronavirus, and then that's what provokes the immune response. Some things that the general public might ask about is will I be a mutant after I get this vaccine? I've heard a lot of different things like that. this RNA um, has is out of the body after about 4 hours. It does not reach the nucleus of the cell. There is no transfer of this RNA to your cell's DNA. Sadly, you will not have amazing mutant powers if you get this vaccine. There's 2 front runners for this. There's the Pfizer and the Moderna. We have these early because they really just needed the genetic code of the virus to get started, and that was shared really before the virus had a name, so they're the first out of the gate. The second are viral vector vaccines. These are where you take a virus that's not what you're vaccinating against. Maybe it's a harmless monkey cold virus, and then you engineer it to carry a piece of coronavirus genes. So then when this is used as a vaccine, it carries the coronavirus protein on the surface or enters cells to make the viral protein. And again, you get your immune response. AstraZeneca is this type of vaccine, what they are producing in conference with the University of Oxford, and that will be the third vaccine we see on the market. Johnson & Johnson is also going to be releasing some information on their phase 3 trials in January. The cool thing about this vaccine is it is likely not to require a booster. It should be a one and done vaccine. There are some vaccines in this type that are being used in earlier limited use in other countries. The third type is your protein-based vaccine. These don't have any genetic component to the vaccine. They're just plugging proteins from the coronavirus onto molecules, a lot of times nanoparticles. Novavax, which I predict will be the 5th product that will come to market, will be in this class. They are famous for using nanotechnology. They might also produce a vaccine that is the flu virus, the annual influenza vaccine with a COVID vaccine booster component. So we'll be looking for that. And then finally is what I would think of as a live vaccine. You have an inactivated or attenuated vaccine. It's been weakened or somewhat destroyed and is used. There are some products in other countries that use this technology. Currently, we're not developing really any of this for use in the United States. I do mention Operation Warp Speed, which did fund a lot of these vaccines. It did not fund the Pfizer vaccine. So what is our timeline? I am telling you, you're going to have lots of questions and limited information today. In 1 week, your email box is going to be flooded with vaccine information. The Pfizer vaccine applied for emergency use authorization November 20th, and that was after reporting data from their phase 3 clinical trials in early November. I speculate, this is just my speculative EUA date, that it will be December 14th at the latest. Moderna has also applied, just Monday, they applied for emergency use authorization. Their phase 3 data came out in mid-November. I anticipate getting approval for emergency use later in December. And then likewise, I'm expecting the same for AstraZeneca towards the end of January. There's some unknowns about AstraZeneca. They had sort of some mixed data regarding their effectiveness. The 62% was a full dose, first dose, full dose booster. The 90% was a half dose, first dose, full dose booster. So I'm not exactly sure how that vaccine is going to look. For the rest of this presentation, I'm really just going to focus on these 3 vaccines. Shipping and storage considerations will be very important. This is an example of the Pfizer vaccine. You see here we have a box with a cooler with 5 flats that look like pizza boxes stacked upon each other with a dry ice pod on top. This also includes with it a monitor that has 24/7 monitoring to make sure that the cold storage chain is not broken. So Pfizer is the one we're reading the most about, talking about ultra low freezer. So the shipping temperature is, we're shooting for -80. This is not a common type of storage. A lot of facilities do not have an ultra low freezer. In the ultra cold freezer, it can be stored for 6 months, but if you don't have one, you can use the thermal shipping box. In fact, you can re-ice it with dry ice every 5 days for up to 20 days. This may be slightly different when the EUA actually comes out. There are some caveats. So the container can't be open more than 2 times a day, and it cannot be open for more than 1 minute at a time. So obviously this is a very strict cold supply chain storage requirements. It is good in the refrigerator for up to 5 days, 120 hours. So a lot of facilities will just need to store it in the refrigerator and vaccinate people as soon as possible to use up their product. Room temperature, it's good for 6 hours. The Moderna product, which we will be also expecting in December, is stored in the regular freezer, again, up to 6 months. It has refrigerator dating of 30 days, which is much more generous, room temperature of 12 hours. AstraZeneca is refrigerated. We know it will be good for 6 months. I cannot find data on room temperature. Just another example of the Pfizer vaccine unpackaging. Use of dry ice in confined spaces or poorly ventilated areas can result in depletion of oxygen, resulting in asphyxiation. Exposed skin should be protected from contact with dry ice. Eye protection is recommended. So there's a lot of other nuances besides that it's complicated. We need to have the freezer, but also have all the appropriate PPE for staff reaching into the freezer and education contracts for people who don't have ultra low storage, ultra low freezer. They may need to have a contract with a local company to get dry ice if they're going to use the dry ice pod over and over. The Nebraska COVID-19 vaccine plan, you can see a draft of that online. I just have one slide about this. CDC believes that COVID vaccines should be limited or will be limited and should be allocated in a phased approach. So we assume an allocation of COVID-19 vaccines will be sent to state government for distribution with the assistance of national government agencies such as National Guard. Our goal is to ensure fair and equitable access and distribute the vaccine in ways that provides the most protection for Nebraskans as quickly as possible. We also assume allocations will be resupplied at regular intervals, and all first doses received can be immediately given. So we are promised a matching number of vials in separate shipments for the second dose. So let's say you receive 200 vaccines, you should be able to vaccinate 200 people. You will be getting 200 booster doses as part of the allocation. Important note that I don't have in my slides, the vaccines are not interchangeable. So if you have Pfizer for the first dose, you do need to have it for the second, and so on. And then in the Nebraska COVID-19 vaccine plan, they do spell out phase 1, 2, and 3. Now the CDC might, after the EUA is released, could have some additional guidance that may influence this, but basically phase 1 is your healthcare workers, high risk, essential and vulnerable peoples. Phase 2 would kind of be everyone else. Phase 3 is your ongoing traditional vaccination. We wouldn't be at phase 2 until supply meets demands, and since we're expecting a low supply, they've separated out phase 1 into A and B, and healthcare workers is phase 1A. Everyone on this call can expect to be in phase 1A. Some other things you might learn about if you're reading through this is open and close point of dispensing sites. An open point would be in a public arena. That's probably not going to be appropriate for phase 1. It could be very crowded, that's not COVID friendly, and there could be an overwhelming public response. A closed point of dispensing is a location that's operated by a private organization for a target group, which may include employees and their families or client members. These are not open to the public. This is probably what we'll see in phase one. So for example, if a hospital is a closed pod for COVID vaccine, all people who work in the hospital, regardless of who their employer is, would be an eligible healthcare worker. So if you are a physician who provides service in this hospital, or some other contracted employee, you would be a part of this family. Although it does mention family for the closed point of distribution, employee family members are not in the phase 1A, but they could return possibly to a closed pod during phase 2 for vaccination. I don't know what that's going to look like. Spoken hub distribution is something we might see as well. So that's when you have a hub that is centralized, and then you have closed pods that are almost used like little warehouses. So they might cater to various areas in the neighborhood. So if a hospital in Lincoln can store a supply of vaccines in an ultra low freezer, then you might have critical access hospitals that come to pick up their allotment from the large hospital instead of having, let's say, the National Guard delivering vaccines all over. And then they could pick product up and keep the cache, the large, wherever the vaccine is secretly stored, the less we can go in and out of that, the better we can preserve the cold chain for that supply. So, and this is kind of what it might look like, where city 1 could be Lincoln, city 2 could be Omaha, city 3 might be Kearney, city 4 might be Scotts Bluff, and then there's some sharing in the community. Vaccine preparation and expiration are unique for each of the vaccines. This is an example for the Pfizer product. The vial needs to be removed from the freezer to thaw and prior to reconstitution. It's reconstituted with sterile sodium chloride, which is not included or packaged with the product. It's a unique dilute with 1.8 mils. And then you draw up 0.3 mils for each dose, the vial of each containing 5 vaccines, or doses rather, and the booster is given at 21 days. So here's a table I made to kind of compare them. Pfizer, again, thaw vial for 20 minutes, dilute. Moderna has no requirements. It's going to come supplied as a liquid. I do not have information on AstraZeneca today. The dose for Pfizer is 30 micrograms in 0.3 mils. The Moderna dose is 100 micrograms in 0.5 mils. And the AstraZeneca might be the half dose, full dose. We don't know. The Pfizer vial contains 5 doses. The Moderna vial contains 10. Both of these expire after 6 hours if you've diluted it or spiked the vial. So you would need to line people up so that you can give 5 or 10 vaccinations within 6 hours. The boosters also vary. It's 21 days for Pfizer, 28 days for Moderna and AstraZeneca. I get a lot of questions about package insert and information about these products. There is no package insert. It is not FDA approved. When an emergency use authorization is granted, the medications will have a provider information sheet. It's kind of like a package insert, and that is going to share a lot of information that people are looking for. So what's the appropriate monitoring parameters? What is the select population that we can use this medication in? And again, as of 12/4, no provider information sheets are available at this time. Vaccines traditionally have a vaccine information sheet that is required for patients to see. That again is not available for this product. When an EUA is granted, there will be a patient fact sheet that is required to be shared in order for each of us to make an informed consent. A patient presenting for vaccine really is considered consent. You may elect to document consent in the medical record or with the patient's signature. That would probably be at the discretion of the institution. And again, there is no patient fact sheet available at this time. There is a new product for this to report vaccine adverse events. It's called vSafe. It's a new system to monitor safety. And the CDC is asking that providers give everybody who receives this vaccine a flyer, poster about it. It's a smartphone-based technology. People get text messages to provide health check-ins, and they can report their side effects. They also get a reminder for their second vaccine dose. People can opt out. It does keep in contact with them pretty frequently for the first 5 days, then once a week for up to 5 weeks. If you are interested in building some of this in your EMR platform, we do know what the NDC numbers, what the anticipated NDC numbers are. I don't know how Moderna or AstraZeneca will be supplied. Pfizer currently will be supplied in trays with 195 vials and up to 5 trays per shipping box. Cost-wise, these first doses will be free, if you will. The American government is buying these and providing them to the states at no cost. But as far as the manufacturer cost, AstraZeneca will be the least expensive. They've also agreed to provide their vaccine for low and moderate income countries at the manufacturer cost for an indefinite amount of time. And then there have been CPT codes provided by CMS. And for the first time, there is a separate CPT code for the first and second administration. There's no other vaccine that has a different administration code for a booster. So some frequently asked questions. Thank you everyone for sending in some questions. I tried to capture all of those and then some others as they kind of came to mind, or I've had other people ask about them. This is a blackout poem that my daughter Claire did as well. It says, "A lovely dream about germs wearing a pair of fuzzy slippers." So some questions that I've heard: what are the most common side effects from the COVID-19 vaccine? So Pfizer reported no serious safety concerns. Fatigue and headache are the most common. Moderna also reported no serious safety concerns. But there are a lot more side effects that seem to have been reported with this vaccine. It might have to do with the higher dose. It's also noted that when people had the booster, they had much higher symptom rate than the first injection. So this is something to consider when you're vaccinating your team. You may want to layer your appointments so that some of you get it on Monday, some of you get it on Wednesday, some of you get it on Friday. So not everybody is potentially missing a day of work during because of these symptoms. These are COVID symptoms. So even if someone presents with these symptoms thinking that they are vaccine related, we don't know if we've received the vaccine early enough. It could be COVID. So based on whatever your flow sheet is for your work, these symptoms may require people to quarantine. Will shipments of COVID-19 vaccine include ancillary supplies? Yes. It's going to have supplies for injection, reconstitution. It's going to have some PPE for the people providing the vaccination, and vaccine cards. Vaccine cards will be in Spanish and English. It is just a reminder card for people to know what brand, lot number, when they receive their vaccine, when their booster is due. Is it necessary to start a COVID-19 vaccine series over if a patient doesn't come back for a dose at the recommended time? This is unknown. We expect it to be addressed directly in recommendations. It is noteworthy that the phase 3 trials, even though it's 21 and 28 days, most of them had a date range. So for example, the 21-day Pfizer booster was administered anywhere between, I believe it is 18 and 22 days. So there is a little bit of wiggle room there. Some other frequently asked questions: what are the reporting requirements? I'm going to describe it as a big deal, and it's another reason why all of these first doses of COVID vaccine are going to be completely organized by our Nebraska vaccination plan. Every single dose that's administered needs to be reported to the Nebraska Immunization Information System within 24 hours of administration. You can enter it manually, you can have it sent electronically through an EHR. They are maybe working on some other mechanisms. This information includes patient information, the lot number, date and time of vaccine, and could be cumbersome. Can the public pre-register for mass vaccination events? I believe this technology choice for this is state specific, and there's probably a solution in the works. I've seen some products that other directors that I'm colleagues with in other states have shared. I am not an expert as far as what is being provided or created in Nebraska. What are the contraindications and precautions? Those are not determined yet at this time. I'm sorry. Is the COVID-19 vaccine made with fetal cells? No. Are there fact sheets available for the vaccine? No. Once the EUA is granted, that information will be available. What does healthcare worker mean in phase 1A? All the things. Anyone who is healthcare personnel, anyone who works in a hospital, emergency rooms, people who work in long-term care facilities, urgent care, primary care access points. When can we start vaccinating children? We will have some guidance on whether this is appropriate for children. Presently, these vaccines were not studied in children less than 12 years of age. I anticipate studies of that kind will be starting soon. Same question for pregnant women and those lactating persons. The vaccine was not studied. We will have to see what the EUA guidance recommends. What about immunosuppressive therapy? Should I hold this prior to the vaccine? Again, that is unknown. It's possible that ACIP will address this. mRNA vaccines won't cause COVID in immunocompromised patients. Also, there's such a high efficacy rate in a 2-shot series. Maybe the risk of holding immunosuppressive therapies would outweigh the benefit. That is just my clinical question. So can a Nebraska provider offer the COVID-19 vaccine once vaccine availability has increased? Yes. Contact the Department of Health and Human Services. Will someone contact me about being eligible for phase 1A? Yes. I assume this is part of the DHHS. I assume this will be provided in an email. Like if you are a licensed healthcare provider, guess what? DHHS has your information. How long do I need to monitor someone after receiving the vaccine for side effects? Unknown at this time. I've heard a rumor of 20 minutes. I have no idea. I expect that the EU, I meant to put EUA provider information sheet will address it. Will there be closed pod sites in Lincoln? This information has not been shared at this time. Traditionally, this is not public information. I think we can all assume at some point over the next 3 months, every hospital will be a closed pod site at one point or another. I just can't share which ones will be first. And you might have some patient concerns. So, people might be worried about a new vaccine. And I urge you to have candid conversations with your patients. I know it was created really fast, but there was a lot of safety and efficacy. The trials were huge, 30,000 to 44,000 participants in the phase 3 trials. And really the timeline shortened was because they were doing a lot of things at the same time. So while they were doing vaccine development and testing, they were already beefing up the manufacturing process. So that had a financial risk, certainly, but it was, purposefully done to help get vaccines on site sooner. And a lot of these trials were overseen by the federal government versus letting pharmaceutical companies decide their protocols. So in summary, mRNA vaccines, Pfizer and Moderna will likely have EUAs in December. Probably everyone on this call will get a Pfizer or Moderna vaccine soon. Nebraska has a controlled allocated distribution plan with education and communication coming very soon. All healthcare workers will be contacted to arrange for vaccination. Pfizer vaccine is good for 5 days refrigerated, Moderna for 30. After the emergency use authorization, Fact sheets for providers and patients will be available. And please encourage people to get vaccinated and to use the VSafe application.
Emily, you answered every question, and I so appreciate it, even though some of them we're not aware of yet. As I said to you before, we may very likely need to ask you back. Are there any specific questions for Emily? I will tell you, Director Lopez is going to answer some of the more specific things for Lancaster County, as far as you will not need to call or contact DHHS. We have, with the hospitals and the health department, we have a pretty organized alert system here that she will be talking to you about, and it's developing as we speak. Any other questions for Emily before we let her go? And Emily, I see you very graciously shared your email, so we may absolutely come back to you, but we do have a couple. Will sites get to choose Pfizer versus Moderna, or will they just send one?
They'll be sent.
Well, pardon me, Pat?
What we've been told is we'll receive our allocation, and at the beginning, sites won't be able to choose which one they want to use.
So in other words, we'll take what we get.
Yeah, and I think we can expect the urban areas to get more of Pfizer because we have more ultra cold storage available.
Do either of you know if both doses need to be from the same lot?
They don't need to be. Emily, you can answer that, but this is a question I asked yesterday because we've been hearing this. And so when we had our call with the vaccine, on the vaccine with the state yesterday, they said that's not true. And I don't know, Emily, is that what you've heard as well?
I have heard mixed. At first it was same lot number, then it was not same lot number, it just needs to be the same manufacturer. They're creating so much, it might all have the same lot number, to be honest. So more to come on that.
And the last question, again, I think it is, wouldn't the storage dictate the kind sent? We'll get what we get, and we will distribute it as we can. Pfizer first, as Pat indicated. So I know it's frustrating to say we'll get what we'll get, and we don't know this yet, but we will get as much information out to you as we possibly can. So Emily, feel free to stay on. We're going to thank you again and transition to Pat, who's going to give you just a quick, more specific Lincoln-Lancaster view.
Okay. I just wanted to give you, Emily's covered most things, so I'm going to just kind of go rapidly to tell you more specific, as Joan said. So when the vaccine is authorized, we will do these specific phases. So I've used in there those definitions kind of along the same thing. And the ACIP recommended residents of long-term care also be added in there. And I do want to say in Nebraska, we have advocated strongly that we prioritize the staff at the long-term care facilities to be vaccinated, as well as residents, even if there's limited dosing, that then the priority be the staff, because in our experience here in Lancaster County, which will make perfect sense to you, it's the individuals coming into the facility that are exposing the residents to this. So, and you'll have this definition, we can share this with you about who healthcare personnel are. And they also have added, one thing that has been added in this priority area is our paramedics for this group. So I just put in here the essential work, the phase 1B will be the essential workers, the high risk, those with high risk medical conditions, and adults 65 and older. That'll come in after we get through phase 1A. We've been, you should know, we've been planning for some time. We've had plans in place for being able to respond in the community And what we've done is updated those a lot. And I included the slide that's being used to provide information to us about who is in those first groups. So, and giving you some examples, and I'll be sharing these with you so that you can have them just to have as an example. But as Joan said, and Emily, so many things, this is so fluid that things change rather rapidly at times. So this is where we're at today when I'm speaking to you.
And Pat, I'm just going to ask, because I'm sure somebody will, outpatient clinics are not listed. Would they be considered in 1A, like our doctor's office?
Yes.
Okay.
And I just wanted to share, we've had a COVID-19 vaccine advisory committee, and these are our current members, and we're adding Dr. Potts as well. So we'll be meeting in the next week again, now that we know more about the vaccine. We've been waiting to reconvene so that we actually had some of the information, more fact sheets, so we could move forward. But in the meantime, we've still been setting up everything that needs to be done. So the recommendations are those priority ones like we talked about. We have local health department staff here that we also need to provide vaccine for because they'll be working out in the community. Then we'll look at essential functions. These are some of the things we determined from our advisory committee: fire, police, EMT, our educators. Concern, we have a lot of concern about those working in meat processing plants or other areas. And of course, the staff and the residents, and then our vulnerable population. We've also really prioritized individuals in our community that experience health inequities as well, who've been adversely impacted by the COVID-19. Some of our challenges are that the vaccine occurs in phases, as Emily said. They each have different storage and handling requirements. The 2-dose that Emily talked about, the mixing kits, everything's supposed to come with the vaccine, so we'll be able to administer it. And there's a lot about just storing the vaccine and ensuring the safety. So there's a lot of different requirements in that, and that's something the health department's really familiar with from our areas. And so are a lot of our physicians' offices that have been doing vaccine for children. And we know that our vaccine is being distributed by the state based on population. We've been working through a lot of the things about the social distancing from mass clinics and where we'll have those mass clinics at. And you should know, there's a map with all the ultra cold storage locations in the state in general, not exactly where they are, but and as you go, as you would expect, outside of Omaha and Lincoln, those that availability becomes less and less. So we really think that we'll probably be getting more of the Pfizer initially here in Lincoln and Omaha. In the hospitals, I'm going to have John and Mike talk about the hospitals. They'll explain that. But we have written MOUs with 33 local facilities and other entities to dispense vaccine to their own employees. We have 7 long-term care facilities that have closed pods agreement with the Lincoln-Lancaster, and we'll be using that. Many of those long-term cares and assisted living, you probably have heard that the federal government has a contract with pharmacies, so CVS and Walgreens will be actually being the ones that are going in and administering the vaccine to those staff and residents. And 80% of our long-term cares and assisted living have signed up with either CVS or Walgreens for that service. We have a larger business. You know, for example, you could think about like Lincoln Electric system. They're bringing in individuals to administer that vaccine in their own area. That pharmacy process is part of a huge federal and national initiative. It's not specific to Nebraska. That'll be occurring all over. Then I just wanted to share with you, this is our state forecasted allocations of the COVID-19 vaccine. This is as of 4:30 last evening. So it's anticipated from the 13th to the 19th, we'll get over 16,000 doses. Then starting the week of December 20th to the 26th, we'll start receiving both Pfizer and Moderna. And then that'll continue till the end of the year. So we should be getting a total of over 1,000 vaccine doses combined in this before, right. But the doses, there's a population mix. We know how many of these healthcare providers and the allocations. So we feel based on the numbers that we have available, that the feeling is that we should be able to vaccinate everybody in the 1A pod by the 1st of January if we receive our allocations as predicted. I also wanted to let you know that we do have arrangements made where we will go out and vaccinate special populations in different areas where people aren't able to get in. We have plans for how we access those that are disabled or have other problems that prevent them from getting into somewhere. And we'll work with those other offices that maybe not be covered by Brian and Saini. We've been all working together for some time now. So I think we have a good plan in place, and we just need some of the final information to move forward now. So the vaccine is being delivered to the state, and that's what we know. And we still are unclear if some of the shipment to the hospitals will be going directly to them. That's what we keep understanding, but then we hear it change a little bit. And those pharmacy places and the local health department. Our area is going to be serve Lincoln. There is a plan in place to provide the ultra cold storage for some nearby surrounding communities. And I think both Brian and Saini's will talk about too what they're doing with the critical access hospitals. And we will be addressing everyone in the community who's not addressed through one of our other MOUs or by the other partners. And we don't know, we did say we don't know exactly how much we'll be getting every week, but we should know more, and we will keep you up to date on that. And I wanted to get that quickly. Then I also wanted to know, one of the other things I just wanted to share with you, and Tim's on and he can talk about this, but you probably all seen, this doesn't relate to the vaccine right now, but CDC changed their quarantine recommendations yesterday. So Tim will be sending that out to all of you and Joan as well, so we can get it out to the office managers. But basically, they're still recommending a 14-day quarantine period, but anytime after day 5, a person can get tested. If that test comes back negative, they can get out of quarantine after day 7 if they are asymptomatic, have no fever, but they will have to mask and monitor themselves, self-monitor for 14 days. So the other thing that's different in there is if the person does not have a test, then they can be done with quarantine in 10 days if they continue to mask and self-monitor and are symptom-free. So that's in essence, but we have some detailed information we'll be sending out.
There was a question from one of our doctors. Yes, this is recorded and we will send it out to you no later than Monday, but it will be available and we'll get it out to everybody. Okay, lots of questions, and I know you're thinking, okay, when is my clinic up? Well, we don't know that yet, but we're going to talk with John Woodridge first to see how Brian is. I'm assuming they're not going to shut down. They have to figure out how to triage all of these immunizations, and then we'll have Dr. Rapp on next. So John, if you want to tell us, you've got it all organized, I'm sure.
Yeah, right. And I think everybody understands that logistically this is a tough thing to do, but we have been working extremely hard on our plan of how we're going to do this. And right now, for what we're doing from the internal perspective, we're having our management be involved, and we're going to schedule people on the day before they're off for 2 days. So if they have any side effects, we don't worry about a staffing issue later. But in the schedule, our whole focus has been administering this quickly. And I will tell you, as of today, we think that we could probably vaccinate 1,000 people an hour. That's how we've got this down pat, because we're going to ask people to get all that paperwork done ahead of time. When they show up into their allotted spot, we're going to block people like just within an hour time period, so they don't have to say, I'm going to be there at 12:02. And then as they come in, we're going to take their name, check them, give them their vaccination, and they can go back up to their floor if they're a clinical person, and they'll still be monitored by their staff for 30 minutes. If they're a non-clinical, happens to be maybe a person from environmental services that goes into that COVID unit, we're going to go ahead and monitor them and have them stay in the area. We have a space big enough for that. But that's our entire goal, is to make sure we're much more efficient in doing this, because we also believe that if we can show that, that we'll probably be able to get more supply to our area. We do have the freezers here. We do have freezers at some of our other locations throughout the state. So we will continue to work with the state and health department if they need that to be a storage area for people in those rural areas to pick up from. We can do that if that happens to be the case, because I do think, you know, if everybody meets their promise and we get the deliveries like we should from Pfizer and from Moderna, that's great. But if something goes haywire, I think we just need to have a plan B that we can go ahead and ship that other product. The staff are extremely engaged in this. I think this is the light at the end of the tunnel we've been waiting for. So believe me, there's a lot of people's head around making this be successful and getting it out to folks. We do have a commitment that at the direction of the health department, we will make every accommodation to take care of. If we're assigned to take care of all of the physicians in their mid-levels, we'd be glad to do that. We do think there will probably be a different plan for taking care of your staff within your own specific independent practices. But we'll do whatever it takes, whether you're a physician that does come into our facility or not. As we go through that prioritization, we'll make it easy for you to get your vaccination. Do you guys want to report on? I will tell you our numbers of COVID patients have decreased a little bit, which is just a great sign, because I will tell you that what we've been watching happen was kind of getting out of control. But we are still waiting to see what happens now, the effects of the Thanksgiving holiday, see if next week tells us a different story. But it's nice to have a little bit of a breather. And, you know, it's funny that we say a little bit of a breather when we're down to 96 positive or 86 positive patients and another 27 still recovering. So we're still well over 100, but it beats 150 that we've hit a few days there. So take any questions or people might have.
And Pat wants to ask you a question too, but speaking for our physicians, I know there's the physicians and the mid-levels, and then there's our clinic staff. We'll let them know that once you've got all of your people immunized, then you'll reach out to them. They don't have to be bugging you.
Correct.
Okay. And there'll be a schedule or whatever. Okay. And Pat has a question.
Yeah, and we'll be working here at the health department with both John and Mike about making sure we get everybody notified. John, I just wanted to mention off the vaccine thing when you were talking about the hospitalization. I think the physicians would be interested to know that we've seen a real increase in the number of Lancaster County residents that are requiring hospitalization. Generally, it's been our individuals in the community needing the hospitalization has been lower than what's coming in outside the community, but we've seen that change here in the last couple of weeks.
So, again, I feel like, go ahead.
I was going to say, just to state those numbers, so as Pat was mentioning that, we were seeing about 2/3 of our patients from outside of our county. Now we're about 60% in our county is our patient population, and only 40% from the outside. So almost a flip of what we'd seen before.
Okay, so then this is a question for both Pat and John. Can our physicians at least be thinking they will get opportunity for immunization in December? Yes? Pat's shaking her head, John. So I guess if you can do 1,000 an hour, you can do us all.
I was going to say, if they keep the vaccines coming, we'll get them taken care of.
Yeah.
Okay, so that will be the physicians, and then hopefully in January at the latest, we can come up with a plan for the nurses and the clinical staff.
No, we're planning that the nurses are going to be in this.
In the doctor's offices.
I mean, that's what they are basing our population number on, who those licensed personnel are. So.
Okay, so it should be soon. December, January, we should get everybody offered the vaccine. That now we're not sure where that will be, but either with John or possibly St. Elizabeth's, and Dr. Rapp will address that next. Okay, thank you, John. Dr. Rapp?
Hi, everybody. How come I always see Rauner? Now he's got facial hair. Looking good. All right. So much of what John had talked about, we're certainly not going to try a race, though, with 1,000 an hour. That's pretty impressive, John, to get that rate. But we will give out whatever we get. And again, I emphasize, we don't know for sure what we're getting. We will absolutely coordinate with Pat and with John. And our full intent, as I told Gary Anthone yesterday, is to be sure that the physicians and caregivers in Lancaster County are covered, and we will do whatever is necessary to be sure that occurs. Our numbers at St. Elizabeth have also dropped a little bit, breathing a bit more freely, although our ICU continues to fill up. And not only with COVID, but with all the other diseases that are so prevalent in the community. So it's just the way it is. But right now, we are not overly stressed for people as we were a week ago when I had some time off. I spent time as a nursing assistant again, and it was fun. I enjoyed it. And I look forward to doing it again if I need to. I'm not sure they'll invite me back, but they claim I did a good job. The second thing is the bamlanivimab. We have given 22 doses so far as all. I'm a little surprised that it's not being used more. Again, that is the monoclonal antibody. I have personally sent out emails to every physician in town twice. If you claim you have not gotten it, then you are either not on Brian's list or not on my list, because I sent it through Eric Moose and John at Brian too to try and disseminate this information. In a nutshell, it's a monoclonal antibody to be given within 10 days of the diagnosis. It is not for hospitalized patients. One physician had that wrong. It is for outpatients. They come in through our emergency room entrance. We take them directly to the room. They spend a little over 2 hours there, 1 hour for the infusion, and after an hour they leave, after the second hour. We are happy to do that for the community. You can call in and to our schedulers. They have all the information I disseminated. Some folks are happy to tell us They don't read our emails anyway, so you can still get the information by calling in and asking the scheduler. She will get it out to you. Anybody over 65 can get it. They're high risk. Anybody 55 and older that have high risk factors, cardiac, obesity, anything can get it. And what's more, 14-year-olds and above that are over 40 kilograms, if they have high risk factors, can get it. We're infusing an LVAD patient today who thought they had to go visit their parent, and guess what? Their parents were positive. So the bamlanivimab is going well. We're very pleased with how our employees have band together to make sure there's sufficient coverage, even though it does stress the infusion center. We have volunteers that help, and yes, I have volunteered in that unit as well. The last thing is Test Nebraska. It is going extremely well right now. We are testing over 5,000 people a day. We are keeping up and turning it around in about a day. We have plans to get to 10,000. We are starting basically a second lab downstairs right now. We seem to have sufficient people hired, but once we get that second lab going, we'll see. We may have to hire a few more. But they are highly motivated and they're doing very, very well at keeping up. Joan, was there anything else that you wanted?
I think that is great, and Pat needs to finish up, but before that happens, it hits me that every clinic that is listening, and I'll send it out as well, you need to do some internal planning. So once you're tapped to come in and get your vaccine, you'll need to do exactly what John and Dr. Rapp have said. Is it every other doctor? I mean, you'll need to think about how you don't want to close down your clinic, and so maybe have 2 or 3 tiers of people that will go at different times. So that's your homework assignment, I guess. And Pat has a...
I also wanted to share that the state is developing a communication plan for the COVID for the public. They're working on that now. And then John was talking about, I'm not even gonna, the monoclonal, they are working with long-term care centers to be able to administer that there if possible. There's a couple pilot sites going on across in some other states, Chicago and a few other places, and they're using CVS Pharmacy. So we'll keep you up to date on that. I also wanted to share with you that we have, in the last couple of weeks, actually the last 2.5 weeks in our long-term care facilities and assisted livings, we've had 228 cases among residents, which is 59% of all the cases we've had reported among residents in the last 9 months. So we've had some major outbreaks in at least 5 different facilities. You've probably been seeing about that. Most of them are trying to manage within the facility. We brought in ICAP and all kinds, and that's the university place from the Global Center to work on infection control methods. And the other thing I thought that the physicians would be interested in the first 6 months of the pandemic, we experienced 24 deaths in our community. In the last 3 months, since the beginning of October, we've had 66 individuals from our community who are deceased now. And so we can see, of course, with the case numbers going up, that's in general. You've also probably heard that we've changed our directed health measure, and youth extracurricular activities are going to go on. And there are some special measures that they have to have in place, like it's not only just the facility now, but the teams are going to have, or whoever's sponsoring, a plan in place. And they are going to have to report to us if they have positives on the team. I know this might be shocking to you, but we actually have when we've done interviews, we actually have parents not share that youth have been participating in sports or doing other things. And so then we piece it together later down the road. So that's kind of a problem. That's where we've had some outbreaks. So we're working on that, and we wanted to take this time and that pause to really make sure we have all the right things in place for everyone.
We have a couple of final questions. First of all, if they are registered as a closed pod, will they get their own vaccines delivered to them?
Yes.
Okay.
That's what we know right now. So if you're one of our closed pods, I didn't want to say who they all are.
So, and then with respect to outpatient medical clinics, do we include all employees, physicians, mid-levels, administrative staff?
As far as we know, right now it's been physicians, mid-levels, and we'll have to, as far as I know, we've been told it'll be administrative staff. It'll be working.
Because John, you are giving vaccines to your administrative staff, yes or no?
No, we're the non-essentials.
Okay, well then never mind.
We did have somebody comment that either Russ or I should get it, but we both kind of just said we're going to wait. So.
Well,
Yeah.
I would think in clinics though, and to me, administrative staff are like front line. I'm the check-in, you come in, and that's considered a.
Yeah, if they're registration people that are going to be,
what I was thinking
of course,
too,
yeah, they're covered.
Yeah, so I think in respect to the question, if you have billing people that never interact with patients or that type of thing, you may, again, want to, until we have so many vaccines available, get the highest risk first.
Yeah. Lab,
X-ray, anybody that has a face-to-face. We are coming right up on the hour, but do you have anything else, Pat? So yes, if you're a closed pod, at this point in time, you will get the vaccine. I anticipate we'll try to have another call next Friday. We have been going every other week, but if there's any information.
If you're not a closed pod, we'll be in touch with you and let you know, because we'll probably have you come to one of the sites to get vaccinated. So we'll be working with you. We'll reach out to you.
So once we know where the sites are, I can communicate to the offices and say, here are the sites. You can contact this person to sign up your staff. It's a lot of trust because it is, as everybody has said, boy, it is a moving target. And I just want to, as always, thank John and Dr. Rapp and Pat, Jesse, who runs the wheel here, as well as especially Emily. Thank you so much.
Yes.
Your information was very helpful. And as I said, we'll send this out on a link so that if you had to hit and miss, or if you need to share it with somebody, you can do that. And I just say stand by. We'll give you more information as it comes to. Thank you so much.